Hello students, my name is Divya Gupta and I am a pediatric neurophysiotherapist. I am going to demonstrate the techniques that we use in exercise therapy. These are going to be useful for physiotherapy students and new practitioners. We have with us Shweta. She is going to be a dummy patient for us. Today we will continue to learn how to give relaxed passive movements. Coming to the elbow joint. Position of the patient is supine lying. Position of the therapist is straight standing by the side of the patient. Stabilization proximal and distal to the elbow is by the therapist's grasp. If we are performing the movement on the left side, which is the case here, with your left hand, stabilize the patient's distal arm and with your right hand, cross over and grasp the patient's wrist and hand. Then perform the movement through the available range and then return. An important precaution to take here is the amount of traction that we give because of the risk of development of myositis ossificans, which is very common at the elbow. As we return to extension from flexion, you have to ensure that there is no forward tipping of the scapula, which is happening here. This is a trick movement that happens to disguise elbow extension. Coming to forearm pronation and supination. The patient continues to be in supine lying. The therapist continues to be in straight standing. Stabilize the patient's distal arm with one hand and with the other, grasp the patient's hand and wrist using a handshake grasp. With this grasp, there tends to be movement at the wrist joint. So, to avoid any trick movements, we should rather use the pistol grasp. And then perform the movement. As we perform pronation and supination, the radius rolls over the ulna at the distal radio-ulnar joint. In an alternate grasp, you can stabilize the patient's wrist and hand by placing your index finger between the patient's index finger and thumb. The remaining fingers grasp the wrist and stabilize the wrist. The other hand stabilizes the distal arm. And then perform the movement of pronation, and this is supination and pronation. Today, I demonstrated how to give relaxed passive movements at the elbow joint. For many more such videos, stay tuned.